So Chanel, thank you for the drum song. So today we're here in New York City at the United Nations Permanent Forum for Indigenous Peoples to speak about Indigenous issues. As Tsilhqot'in people, one of our main issues is the toxic drug issue that's happening, not in only in our community, but many other communities. But it is top of mind for us as one of our top issues. Over a year ago, we declared a local state of emergency, and today we are still dealing with this issue. As we were coming over a week ago, we got news that another one of our community members had passed from an overdose. And so we are here today to bring this issue back to the table. And I have to speak first Chief Francis Lassise, who is our Vice Chair for Tsilhqot'in National Government and also is Chief of his community, Tlesco. So I will pass it over to Chief Francis.
Tanasha, thank you. Yes, we are here at the United Nations talking about implementing UNDRIP as a way to improve the lives of our people in the ilhqot'in. Just as Jenny was saying, last year the ilhqot'in nation declared a state of emergency because of the toxic drug crisis. Also, the residential schools was our people. We weren't supposed to be here anymore. The drug crisis is a continuation of this threat to our survival. Another issue that was in our nation as part of our history was the smallpox, another genocide that was intentionally happened to our people. And I compare this drug crisis is no different than that era, and it almost looks like kind of an ethnic cleansing by the governments. I think another one is, I think the statistics will show the how many people have passed just in our community or at the nation level, BC level, and even right across Canada. I think that's something that we have to pull up, and so I think that's just the issue is going to continue. And another report was done by the First Nations Health Authority. First Nations life expectancy in Canada has dropped by 7 years because of mainly the toxic drug crisis. So lots of issues, and a lot of organizations are they're there trying to help, but I think the government has to intervene, especially the Canadian government and British Columbia, to help us with this crisis. So thank you very much.
So Chanel, thank you for that, Chief Francis. Yes, as you mentioned, there are so many different reasons for these drug crises, and we need to lay out what those issues are, and I appreciate your comments. Thank you for that. Next, we're going to go to our Youth Ambassador, Dakota Diablo, who is also a member of Tlesco.
Dakota Diablo Satsada. I'm a proud Tsilhqot'in youth, and we can't talk about the drug crisis without talking about public safety. The public safety system in Canada continues to fail Indigenous peoples because it was never built for us. We have our own traditional laws, values, and systems of holding our people accountable. We are calling on the federal government to take action immediately and recognize Indigenous policies and policing as essential services, and commit stable long-term funding to Indigenous-led public safety systems. Back home, we aren't treated equally. Each of us have our personal stories And with systemic racism that views Canada's policing system as a threat rather than a form of protection. How can our people seek help when structures meant to support our people cause so much harm? Sachanalya.
Next, we'll go to Sierra William, also a community member of ilhqot'in.
Hi, Sitsozi, Sierra William Hante. So hi, my name is Sierra William. Death has been so normalized with our people. Smallpox, residential school, 60 scoop. This has all led to trauma and tragedy in our communities. The Truth and Reconciliation calls to action outline what needs to happen to improve the health and wellness of our Indigenous peoples across Canada. If the calls to action were to be realized, some of our people wouldn't have a reason to turn to drugs. For me, self-care isn't about bubble baths. Self-care for us is doing things to connect us to our culture, to our ways of life. The exact things were taken away from us through colonization. Article 21 from the Truth and Reconciliation Commission of Canada calls to action state that we call upon the federal government to provide sustainable funding for existing and new Aboriginal healing centers to address the physical, mental, emotional, and spiritual harms caused by residential schools. It has been 10 years, 1 decade, since the Truth and Reconciliation Commission of Canada calls to action were made public for everyone to understand, to implement them through whatever power they have hold. Sachanalya, thank you.
Very powerful. Thank you, Sierra. It's so good to hear from the youth on this issue. Next, we'll go to Chief Roger William of ilhqot'in.
Chanaya, so the Roger says that ilhqot'in, we are in crisis. We want to make decisions for our own people and have a voice at the tables dealing with the toxic drug crisis. We call on Canada, the province of BC, and 3 main things to address the crisis. 1, support First Nations communities with the resources needed to deal with the issues in our own way. Example of this is on the land treatment processes, supportive recovery through equine therapy, and programs, the funding to support our culture and language, teachings and practices. 2, support First Nations communities in our ability exercise our voice in the spaces that address access to services. Examples of this are our people having to sit in an emergency room all day and to access detox services, many of which face racism and discrimination in these spaces. We must make it easier for our people to get help. 3, housing. We know that when people are appropriately housed, they do not need treatment. The basic needs of our people must be met to stop our people from falling into using drugs. If we can provide safe and secure housing for our people, then they have a place to come together and their families and get social support. They need to overcome their addictions. This housing must be both in our communities and outside our communities. We recognize that we, not only First Nations going through this and want to find space for all First Nations to come together and talk about solutions. Lastly, we want to recognize all those that have lost loved ones to the toxic drug crisis.
So as you've heard today, we've identified the issues. We know why there's a toxic drug crisis. There's so many different systemic reasons why we're going through what we're going through today. You've heard our youth list their reasons, and you've also heard Chief Roger give solutions. As Indigenous people, we know what the issues are, we know what the solutions are. We need partners to come to the table and help us bring our solutions to the table and move forward in a good way. We thank you guys for listening today. I'm going to open it up to the press online. If you are wanting to ask a question, please turn your camera on and identify yourself. We want to close in a good way since we have a few moments. Oh, yes, please. Hello.
Hi there, my name is Brena Owen. I'm a reporter with the Canadian Press based in Vancouver. We did do a story a year ago when the state of local emergency was declared, and I wonder if you could just describe what has happened in terms of progress with partners and have any of your needs kind of been addressed over the last year, or just, yeah, if you could maybe tell us a little bit about what the last year has looked like with the state of local emergency.
Yes, since then we have managed to get some funding. We have managed to hire a project manager and obtain property for the beginning of on-the-land training, but we're still needing more resources. We're needing more immediate resources because the planning's coming along, but we need immediate beds for our people that are detoxing now. And we do have some solutions and some plans in place, but we need funds, we need resources to move forward with those. So we need immediate help in the meantime while we are creating our on-the-land programming.
Could I just ask you also to identify yourself? I just missed your name and title as well.
National government. You can't hear me?
I think your mic got turned off.
There we go. I can see the red light. Yes, my apologies. My name is Jenny Philbrick. I'm from Glen & Co. and I'm the Executive Director for ilhqot'in National Government. Thank you for your questions.
So am I allowed to just to jump in with the question? Okay. My name is Taran Midzane. I work for My Care Now in Quesnel and Williams Lake. You mentioned that you need more resources and immediate help within. You mentioned specifically immediate beds. Do you have numbers about how many beds you have currently, and how many you need to have to kind of be at a safe margin to be able to properly support the overdose crisis going on right now?
Okay, so I don't know those exact numbers. We do have healthcare teams that we could follow up offline for those numbers, but we do know that we have the Runner House that is a detox, has 4 detox beds currently in Williams Lake, and it is being shut down at the moment right now. So we need all the beds as possible, and right now we're at 0. So no.
Then just a follow-up with that, when you say it's being shut down, have you talked with the city and or an interior health authority about the shutdown, ways to kind of move around, and what were their kind of responses to that need?
Following up, I don't know the exact conversation, but we're trying to see if we can help with staffing and with funding to keep them open.
Yep, thank you.
I have a question. I'm trying to think about the process when we think about ilhqot'in communities and where they're located. They're a distance from Williams Lake, and what we see in the north here as well, it's a difficulty finding a bed, but also when people are ready to detox, when people are ready to make a change, it's very difficult to get access to any beds. How is that compounded through both the distance that you have from your communities and what you mentioned, that systemic racism that still exists in the healthcare sector?
Yes, yes, we have a lot of issues with that, just our distance, but some of the, some of our health services that pay for some of these beds and whatnot, they only pay for certain ones. There's lots right across BC, but some of the better ones are not paid for. So in some instances, like in my community, we'll bring the person down to some of those that we've been using some different ones that seem to work for our members, and we have to kind of just pay from wherever we can, and so that's cutting into different programs and stuff like that. So yeah, it's a bit of an array, and I think the government's working on trying to open more places and whatnot, but it seems like a kind of a slow process, and especially when you have a crisis, probably just not in our nation, but I think there's a lot of other nations that are in the same situation with us, so yeah, that's some of the difficulties we're experiencing right now, and we're doing our best to try and help out where we can. We did have a meeting with the BC government here a couple of weeks back, and these issues with this detox center in Williams Lake closing down and whatnot, we let them know that, and we did mention that we're still in dealing with this drug crisis daily, and the federal government's just going to be going through an election, so we will be back talking with them as soon as that election's over, and so some parts of it we're just in a waiting game. Same with BC when they were doing their election, so it's kind of it slows things down, but we're trying our best. Thank you.
Thank you very much.
And private detox centers, the public detox is taking way too long for our people, and in the meantime, while they're waiting, some of them aren't surviving, some of them aren't lasting. So we need access to both those beds and treatment centers to address this emergency.
Ask another question, if that's okay. I'm wondering about, so we're speaking about treatment beds, but I also wanted to ask about support for harm reduction measures, things like overdose prevention sites or prescribed alternatives to the toxic drug supply. So are you asking for support in those areas in addition to the treatment beds, and kind of what's the status of other harm reduction measures in your communities?
Honestly, because of funding and because we are so secluded, we don't have a lot of those. So we're looking for total wraparound services moving forward for our people, and working with partnerships and trying to see what's working in other communities and what's not working in communities, what's working publicly and privately, and seeing what we know will work for our people.
I can also one of the things that in our ilhqot'in is our ilhqot'in law, a whole history of our being, and that's something that we're trying to bring back in, and we need program fundings for that. And some of these things are already happening. We have the horse equine, all the communities have horse programs. We also have wild horses, and that connection. And the land itself, we do a lot of gatherings. A lot of our young people are always out there on the land with their elders, with their grandparents. And as a nation, we do different gatherings to work together. But ilhqot'in being a shutdown is a ilhqot'in person with no pre-contact, and that person is who we're trying to come close to. And quickly that person is an individual who grew up into ilhqot'in law, right from the mother's womb, all the rules around the mother having having the child, and when the child is born, and the rules around that. And then there's a different legends and history in that ilhqot'in of how the land was created, how the animals, our old timers talk about, we all spoke Chilcotin, the animals and the birds, and that we all were the same people. And then we know we can bring you to areas that some of our people turn into stone, and there's stories behind that, there's reasons behind that. And the whole being of ilhqot'in is to be able to prepare every child to become an adult, that 7-day journey, and they're prepared for it. And they're taught many rules and legends, drum songs, ceremonies, how to survive off the land. And when they get their man's voice or their menstruation, that's when that begins. So that's something that has been impacted, and that's what we're really pushing for. And a lot of these programs that we look at always goes back to that ilhqot'in law, the land, and our water. Those are really important to us.
Questions?
My questions. Do you feel like then, when you declared this state of emergency a year ago, that you're basically repeating the same call? And has that call been heeded by the BC government?
I feel that it was heard, but I feel that we were set back a little by BC elections and now federal elections. I feel like there was good intent from our partnerships, but I'm hoping now that we are over those elections, and next week we'll be over the federal elections. We can really dig in with our partners and get them to come to the table and come to solutions, and also working with other First Nations, because we know that we're not the only Indigenous community that has declared a local state of emergency, and we want to work with all of our partners and like I said, see what's working and not working in their communities and how to move forward in a good way. And we know we work better together in numbers. So that's why we're here today, is to get our message out there and get other people to join us in this way of moving forward in a good way.
So I guess indirectly, the most important resources are children and family authority, and with the federal and provincial coming to an agreement to move forward. And a lot of that is what I spoke about, is the ilhqot'in law, the lands and resources, the culture. So there's a bit of indirectly that, with governments we're coming to some agreements and working together and moving forward. But we're saying that it's not enough. There's a lot of, right now I got family members who know what's going on, and to deal with a drug crisis is internal, and it's hard to deal with because it's scary, and that's something that we want to move forward. And how do we support that? And there's a long-term, short-term, and interim process that we're looking at and we're working on with governments.
I suggest ending us in a song.
Do you want to end in a song? We can definitely do that. We'd appreciate that.
Such an honor.
Perfect. And if there's any follow-up questions, you can reach out and we will definitely be happy to answer. So thank you guys very much. Appreciate everybody coming today and listening to us about our toxic drug crisis.